Fellow Kenyans, the ministry will continue to conduct targeted testing in high-risk areas. In the last 24 hours, we have tested 922 samples, out of which 14 have tested positive for COVID-19 disease. All 14 cases are Kenyans. This now raises the number of those who have tested positive in the country to 621. The overall number of samples that have been tested in our labs for COVID-19 so far is 29,430. When we disaggregate these positive cases by counties, the results for the last 24 hours show that 10 of these positive cases are from Nairobi, 3 from Mombasa, and 1 from Machakos. You will note that every day we make the briefing, 1 county or more join the list of those counties that have now registered COVID-19 positive cases. Today, Machakos becomes the latest county to record a positive case. This brings to 19 the number of counties that have registered cases of the disease. 13 cases were picked by our surveillance teams, while 1 case is from our quarantine facility. In terms of the estates where these cases are located, 4 are from Kasarani, 2 from Makadara, 1 each from Umoja, South Sea, Irigu in Dagoretti South, Machakos, and a mandatory quarantine facility. The 3 in Mombasa are from Likoni, while the 1 case in Machakos is from Athi River. In terms of age distribution, these cases, 11 cases, range from the youngest age of 11 months old baby, and a 49 years old person is the oldest case. And in terms of gender, 9 are males and 5 are females. I'm happy to note that today we have 5 new discharges. This brings the total number of those who have recovered from the disease to 202. These are achievements that we must celebrate. This would not have been possible without the dedication and commitment of our healthcare workers. To fellow Kenyans, I want to appeal to you to be understanding and warmly receive our brothers and sisters who have recovered from this disease. This is the matter of stigma that we have talked about. We should not stigmatize anybody who has contracted COVID-19 disease. COVID-19 disease is a disease that claims some lives, but most people recover from it. And it is not a disease to be stigmatized. Yesterday, I informed you about a flight that was coming into the country to bring back Kenyans who had gone to India for treatment. I'm glad to inform you that 237 Kenyans, together with their family members and caregivers, arrived last evening and were received by staff from the Ministry of Health, who facilitated their clearance. Many of the returnees were accommodated in hotels last evening at government expense while being processed to proceed home for self-quarantine. Similar flights are expected into the country in the coming days. Fellow Kenyans, you are all aware that the country is currently experiencing heavy rains that have caused destruction of properties and displacement of Kenyans. This is compounding the COVID-19 response. The displaced people have been forced to congregate in makeshift camps with the risk of banding together, which exposes them to the possibility of contracting the virus. We are, however, working with county governments and other agencies to educate them on containment measures against COVID-19. On the issue of cross-border truck drivers, the Ministry of Health is expanding testing capacity to all the counties. This will enable the truck drivers to be tested from the point of origin of their journey. I want to reiterate that the importance of cooperation in this fight. It is one in which quick victory can only be possible when all of us fight together and move together.
34 out of 621 healthcare workers have tested positive for COVID-19, either directly in their place of work or indirectly, like I know of a doctor who visited a friend who was COVID positive. So healthcare workers contribute to about 5.5% of the total number of COVID cases in the country. But I want also to reiterate that so far the healthcare workers have done well even when they have tested positive for COVID-19, and we have not had a mortality or a death of a healthcare worker. Remember, healthcare workers are at the forefront in fighting this pandemic, putting them at the greatest risk of contracting the disease from the patients that they serve. And that is why His Excellency directed that we develop a welfare package to be able to cushion them from this risk, but also to recognize their patriotic duty as they serve the nation. In terms of the samples tested, out of the 29,000 samples tested this far, about 21,000 are primary tests or index tests. The others are repeat tests to find out whether somebody has recovered in case he or she turned positive in the first test. Testing for easily, yes, yesterday we did not do targeted testing for easily because as at yesterday we have two sets of machines, an automatic machine and a manual extractor. Yesterday we were doing a manual extractor, and also our kits for the automatic machine were low, so they were not deployed yesterday. So the number that we have reported here is just from the rapid response teams. However, I'm glad to inform you that today we are expecting a shipment of 8,064 tests for the automatic machine and another 16,000 by Wednesday next week. If this one comes in country, then we'll be able to scale up our targeted testing.
ABSA as a bank remains absolutely committed to supporting Kenya and Kenyans fight this pandemic. And we recently made an announcement to contribute 50 million towards fighting this pandemic. And this was a contribution to the COVID-19 emergency fund. What we are doing today is really recognizing the patriotic fight of our healthcare workers, who we've heard about just a few minutes earlier. And we are here really to donate a humble donation of 220,000 masks. These are 200,000 medical surgical masks, and then another 10,000 N95 masks, among others. We felt we wanted to do this donation at this point because this PPE equipment is critical to the day-to-day fight to protect our healthcare workers from contracting COVID-19. The fund itself is also working on a much more significant acquisition and donation of PPE equipment, which our chairman, Jane Karuku, will be announcing in short order. In this donation, of masks, which is roughly worth 15 million shillings. We intend that donation to go towards Kenyatta National Hospital, towards Mbagathi, as well as Kenyatta University Referral Hospital, and then also Coast General and some of the hospitals in the Mombasa County, where we're seeing the number of cases rising.